I want to be clear that the federal government has no intention of starting to micromanage long-term care. That is a provincial responsibility. But I do know one thing. We all agree that as a country, we need to do better by our seniors. So to support provinces and territories, we'll invest $9 billion to continue addressing the shortfalls in Canada's long-term care sector. So through investments and work with provinces and territories, we're committed to raising the minimum wage for personal support workers across the country to at least $25 an hour. On top of that, we'll invest to help train up to 50,000 more personal support workers so that people don't have to do endless overtime shifts. Our investments will allow us to create more beds, improve facilities, and increase infection prevention. We'll develop legislation collaboratively to ensure that seniors are guaranteed the care they deserve, no matter where they live across the country. And because provinces have different realities, we'll work together to make sure that everyone gets the support they need.
And we know that here in Alberta, it's been very difficult for people and very difficult for healthcare workers. We're seeing cut after cut that is driving healthcare workers out of the province. We are seeing people that are worried if they're not going to be able to get the care that they need. These cuts at the provincial level are only made worse because for years and years, federal governments have been cutting healthcare as well. The Conservatives cut healthcare, and then Trudeau kept in those same cuts. Those cuts at the federal level from Justin Trudeau and those cuts from Jason Kenney are making it so it's so difficult for these workers. And just to remind folks, these are the workers that were our front line of defense in this horrible and difficult time. These are workers that have been burnt out, working hour after hour to keep us safe. These are the workers that are vaccinating us, keeping us healthy. These are workers that are working in hospitals, in critical care. These are the workers that we trust our lives with, and they simply don't have the resources to do their job because governments are cutting the care they need. It does not have to be this way. New Democrats are committed to investing in our public health care, to supporting our healthcare workers, and ultimately making sure people have the care they need.
Michelle Rempel-Garner has been our lead on health issues throughout this pandemic. We've been holding the government to account on slow pace on approval of rapid tests, on vaccines. And I want members of the LGBTQ community to know if they want something looked at, if they're advocating for an issue, as Michelle has, as I have, as other members of our caucus have, we want to make sure that a federal government is responsive to the needs of all Canadians in all communities. It's also why we've been holding Mr. Trudeau to account for his broken promise, now over 5 years, to gay men with respect to the unfair, the discriminatory blood ban. So we will advocate, including asking for Health Canada to examine issues of concern to the LGBTQ community.